somebody's first diagnosed with atrial fibrillation, the first thing you want to do is rule out any causes, any reversible causes of atrial fibrillation, like alcohol consumption or thyroid disease. There's a lot of other diseases that contribute to AFib, are not necessarily a cause, but we want to be able to mitigate any confounding comorbidities that would make it difficult to treat AFib. So at first we want to know how much AFib the patient's having, how intense or life-altering are their symptoms, and again, try to improve or optimize any lifestyle modifications that could lower the burden of atrial fibrillation. And if we can do that and get rid of AFib, that's great. But most of the times that's not the case. Once somebody has atrial fibrillation, if they do not have a reversible cause, most of the time it progresses. And if it does progress, we offer treatments like medication. And this really comes in two different categories. There's medications that slows the heart rate, and there's medication that prevents atrial fibrillation. And the difference is this, is that the medications that slow the heart rate don't stop AFib. They just mitigate the response to AFib. So you can have AFib and have a normal heart rate, but you could also have AFib and have a high heart rate. And generally those people tend to be a little bit more symptomatic, so we give them rate control medications. Then there are people that feel atrial fibrillation itself, whether their heart rates are normal or fast. In those patients, we try to get rid of the atrial fibrillation and put them back in normal sinus rhythm. And there are class of drugs called antiarrhythmic drugs. Now, when AFib ablation was more complicated or more early in the stages of the procedure, and there was a lower risk, the lower success rate, we use more of these medications. We still use them today, but most people get offered either trying the medications first or going right to ablation of atrial fibrillation, which has been found to be significantly more effective, especially with the low risk of complications we have nowadays.